UNFPA country representative Dr. Wilfred Ochan has called for the integration of fistula repair at all regional and district hospitals to enable fistula patients to access all year-round surgical services. He said this during the presentation of medical equipment to the Mercy Women's Catholic Hospital in Mankesim in the Central Region. The equipment, worth $45,000, forms part of efforts by the UNFPA to help facilitate the cure for women suffering from obstetric fistula. Here's a report by Antoinette Abba.
The medical equipment from the UNFPA is to ensure the Mercy Women's Catholic Hospital in Mankesim has the needed resources for the staff to restore the dignity of women and girls suffering from obstetric fistula through free medical surgery. UNFPA country representative Dr. Wilfred Ochan said marginalized and dejected women must be supported to live meaningful lives. He said training of medical experts in neighboring communities will build their capacity to provide care for fistula patients.
When UNFPA comes in, we come in with the understanding that it's a small contribution to the bigger pool of things that need to be done to address fistula. We have to do a lot of things on the prevention side, meaning really having a midwife at every birth. Skills development is essential to continue to be improved with the different complicated, complex cases of fistula that sometimes we get that really need the advanced kind of care. My plea would be that we also need to look at other neighboring hospitals, bring them as part of the teams trained so that they too can go back in their hospitals and offer fistula repair. In this way, we'll then be able to address the backlog of fistula cases that are building up.
A resident obstetric fistula specialist at the center, Dr. Joseph Berko, said fistula is not a spiritual condition.
There is hope for them because somebody is already thinking about them. Somebody has already made a provision for them. All they have to do is to look for this and access it. Whatever care we give to them is given for free, and we want them to get their lives back. And if they feel isolated and they feel stigmatized, we also want to motivate them and encourage them that they are not the only people in this. Several women are going through, and therefore it's not a shameful thing because they didn't ask for it, they didn't create it themselves, so they must have the courage to come out for help.
Principal nursing officer in charge of the fistula unit, Rose Mante, said the supplies will help to improve medical care for patients. The center currently has 25 outstanding cases. She appealed for support from other organizations, saying surgery is expensive.
The whole of last year, we had only one surgery done with 11 patients, just because we didn't have enough funds to do the surgery for the patient. So at the moment, some people have donated a little bit of money that we are to call them, mobilize the patient and do the surgery for them. And whatever we have gotten, maybe we'll be able to cater for about 6 patients. So it means we still have backlog. Even in the community that they are living in, people shun them because the stench on them. So we are appealing if people will continue to support us to be able to do the surgery for our patients. It will go a long way.
The equipment presented to the Mercy Women's Catholic Hospital include patients' monitors, beds with cranks, suction machines and microscopes.
Antoinette Abba filed that report.